Good morning, ma'am. Good morning, classmates. We are the first reporter. So before we will start with the prayer.
Good morning, everyone. Let's pray in the name of the Father, and of the Son, and of the Holy Spirit. Dear Jesus, model and inspiration of the nursing profession, I know that when you ascended into heaven, you left the care of the sick to those of us whom you have blessed with the holy vocation of nursing. Help me to be faithful to the calling so that I can always do the things you want me to do and in the way that you want me to be. Grant that my voice be gentle, that my hands may have the softness and sympathy of your hands, that my presence may bring something of the hope and consolation which your presence brought to the sufferers of your day. I want to do all these things, Lord, but I know that I am weak and can do little without your aid. Please give this aid that aid this day every day of my life so that I can always be what I know you want me to be, an angel of the sick room. Amen.
So this is my report. Introduction. It's all about antihypertensive drug, a type of drug used to treat high blood pressure. There are many different types of antihypertensive agents and they work in different ways to lower blood pressure. Some remove extra fluid and salt from the body, others relax and widen the blood vessels or slow the heartbeat. A person may respond better and have fewer side effects with one drug than with another. Some patients need more than one antihypertensive agent to lower their blood pressure. Anti Antihypertensive therapy seeks to prevent the complications of high blood pressure such as stroke and myocardial infarction. Classifications of antihypertensive. First is the thiazide diuretics. Drug name, I. Generic name. And this is the example of thiazide diuretics. Hydrochlorothiazide, brand name, hydroduryl, route, oral route, frequency, once or twice a day, dosage 12.5 to 50 mg, indapamide, brand name, Lozol, route, oral route, frequency once a day, dosage 1.25 to 5 mg. And the last is furosemide, brand name, Lasix, route, intravenous route, frequency once a day, dosage 200 to 400 mg. Mechanism of action. Thiazide diuretics diurite by blocking the sodium chloride channel in the distal convoluted tubules proximal segment or DCT. When the sodium chloride channel is blocked, less sodium crosses the luminal membrane, reducing the action of the sodium-potassium pump in the passage of sodium chloride and water to the interstitium. Thiazide diuretics are activated by causing a change in sodium chloride concentration distal to the DCT. As a result, ionic channels and pumps work to restore normal sodium levels. This secondary change to balance sodium chloride levels has a number of negative consequences and its effect on the nephron will be discussed in greater detail below and will be referred to the section on adverse effects. When the sodium chloride channel is blocked, there is an increase in sodium and water retention in the lumen and decrease sodium chloride in the DCT. Next. Indication and con- contraindications. Diuretics are a class of drugs approved by the FDA that inhibit the reabsorption of 3% to 5% of luminal sodium in the nephron's distal convoluted tubule. Thiazide diuretics promote nitro- natriuresis and uresis in this manner. Hydrochlorothiazide or HCTZ, chlorothiazide and the indapamide are the most commonly used thiazide diuretics. The FDA has approved HCTZ and chlorothiazide for clinical use in the treatment of primary hypertension. Clin- Clinicians use these agents alone or in combination with other antihypertensive drugs to effectively increase the therapeutic response in severely hypertensive patients. Next. Effects. Side effects: dizziness and lightheadedness, blurred vision, loss of appetite, itching, stomach upset, headache, and weakness. Adverse effects of taking these medications also include a possible increased risk of developing acute pancreatitis. They hypothesized that thiazides have a toxic effect on the pancreas and cause increased pancreatic secretions and pancreatic ischemia. If the clinician observes symptoms of acute pancreatitis, the patient must immediately stop the use of the thiazide diuretic and they should not be prescribed this medication. Next. Nursing implications or responsibilities. Diuretics relieve fluid overload by increasing the volume of urine passed and decreasing the volume of fluid in the body. The consequent challenges to fluid balance require careful observation if dehydration and therapeutic failure are to be avoided. And the responsibilities: monitor weight, intake, output, and serum electrolyte levels, monitor blood glucose levels, or some agents may cause hyperglycemia, follow blood urea nitrogen and creatinine levels regularly, administer diuretics in the morning to prevent nocturia. Next. So the second classification is calcium channel blockers. Drug name defined. And this is the some example of calcium channel blockers. Generic name amlodipine. Brand name Norvax. Route oral route. Frequency once or twice a day. Dosage 2.5 to 5 mg. Philodipine. Brand name Plendil. Route oral route. Frequency once a day. Dosage 2.5 to 20 mg. Diltiazem CD. Brand name Cardizem Delacor. Route oral route. Frequency once a day. Dosage 180 to 420 mg. Okay. Mechanism of action. Calcium channel antagonists work by binding to the L-type or long-acting voltage-gated calcium channels found in the heart, vascular smooth muscle, and pancreas. Non-dehydro dehydropyridines inhibit the sinoatrial or SAN atrioventricular or AV nodes, causing a slowing of cardiac conduction and contractility. They are useful for hypertension, post intracranial hemorrhage associated vasospasms and migraines. Indications and contraindication. Calcium channel antagonists, also known as calcium channel blockers, were widely used for a variety of indications in the 1970s. This class of cardiovascular drugs is one of the leading cause of drug-related deaths. They are frequently classified as either non-dehydropyridines or dehydropyridines, verapamil, uh, phenylalanine, and diltiazem. Benzodiazepine are examples of non-dehydropyridines. Many other drugs are classified. So, non-dehydropyridines are not recommended for people who have heart failure with a low ejection fraction, second or third degree AV block, or sick sinus syndrome because they can cause bradycardia and worsen cardiac output. Next, effects. Side effects: constipation, dizziness, fast heartbeat or palpitations, fatigue, flushing, headache, nausea, rash, swelling in the feet and lower legs. Adverse effects: non-dehydropyridines may cause constipation, worsening cardiac output and bradycardia. Dehydropyridines may lead to lightheadedness, flushing, headaches, and peripheral edema. The peripheral edema is likely related to the redistribution of fluid from the intravascular space to the interstitium. Next. Nursing implication or responsibilities. Educate patient on importance of healthy lifestyle choices, which include regular exercise, weight loss, smoking cessation, and low sodium diet to maximize the effect of antihypertensive therapy. Next. So the third classification is ACE inhibitors. Drug name, Pril. Generic name, Catopril. Brand name, Capoten. Route, oral route. Frequency, 3 times a day. Dosage, 20 to 50 mg or 2 doses. Enalapril. Brand name, Vasotec. Route, oral route. Frequency, once a day. Dosage, 5 to 10 mg. 5 Fosinopril, brand name Monopril, route, intravenous route, frequency once a day, dosage 10 to 40 mg. Next. Mechanism of action. Angiotensin 2 causes direct vasoconstriction of precapillary arterioles and postcapillary venules, inhibits norepinephrine reuptake, stimulates catecholamine release from the adrenal medulla, reduces urinary sodium and water excretion, stimulates aldosterone synthesis and release, and stimulate hypertrophy of both vascular smooth muscle cells and cardiac myocytes. The precise mechanism of ACE inhibitors is unknown. They disrupt the renin-angiotensin aldosterone system, but their effect is not directly related to blood renin levels. ACE inhibitors, as the name implies, inhibit an angiotensin converting enzyme that converts angiotensin to angiotensin 2 reduce and angiotensin 2 production improves natriuresis, lowers blood pressure, and prevents smooth muscle and cardiac myocyte remodeling. Next. Indications and contraindication. Angiotensin converting enzyme inhibitors or ACEs are the most commonly indicated medication in the treatment of cardiovascular and renal disease, including heart failure, acute coronary syndrome, nephrotic syndrome, diabetes, and hypertension. ACE inhibitors should not be given in pregnancy. They were Category D in pregnancy under the old FDA system because it is known to cause skull hypoplasia, anorexia, hypotension, renal failure, lung hypoplasia, skeletal deformations, oligodramnios, and death. Next. Side effects, dry cough, increased potassium or level in the blood, hyperkalemia, fatigue, dizziness from blood pressure going to low, headaches, loss of taste. Adverse effects, there is no treatment for a dry, non-productive paroxysmal cough, which affects 1 to 10% of the population. Non-steroidal anti-inflammatory drugs in intermediate dose aspirin of 500 mg have been shown in studies to help with ACE inhibitors induced cough. ACE inhibitor induced cough is more common in women than in men. The cough is usually dry and it frequently necessitates discontinuation of therapy. The most serious side effect of ACE is angioedema. It can affect any part of the body, including the intestine, but the most serious is edema of the tongue, glottis, and or larynx, which cause airway obstruction. Angioedema is more common in African Americans when there is an airway compromise. The treatment always secures the airway with an endotracheal tube, allowing the ventilation. The edema resolves. Next. Nursing implications or responsibilities. Monitor her vital signs regularly and her WBC count and serum electrolytes, especially potassium level. Periodically give potassium supplement and potassium sparing diuretics cautiously because ACE inhibitors can cause potassium retention and hyperkalemia. Next, the fourth classification of antihypertensive drug is ARBs. Drug name Sartan, generic name Ansel Sartan, brand name Inzarbi route, oral route, frequency once a day, dosage 40 to 80 mg, and candy sartan brand name, Antacan route, oral route, frequency once a day, dosage 8 to 32 mg, losartan brand name Kozaar route, oral route, frequency once a day, dosage 25 to 100 mg, olmesartan brand name Binicar or oral route once a day, 20 to 40 mg. Next. Mechanism of action. Renin secretion is by the juxtaglomeralar cells of the kidneys and catalyzes the conversion of angiotensinogen to angiotensin 1 or ATI in the liver. ATI is converted to angiotensin 2 by angiotensin converting enzyme or ACE and other non-ACE pathways. The main vasoactive peptide in the RAAS is AT2, which acts on two receptors, AT1 and AT2. AT2 activation of AT receptors causes increased blood pressure due to vascular smooth muscle. Activation of AT receptors cause increased blood pressure due to vascular smooth muscle contraction, increased systemic vascular resistance, increased sympathetic activity, sodium and water retention due to increased sodium chloride reabsorption in the proximal convoluted tubule. Sodium, sodium reabsorption in the proximal convoluted tubule is a direct result of A2 and indirectly promoted by increased aldosterone production in the adrenal cortex. Next. Indication and contraindication. The renin-angiotensin aldosterone system is intricately involved in the pathophysiology of several diseases, including hypertension, congestive heart failure, and chronic kidney disease. Has is a common and successful strategy in each of these conditions. Angiotensin receptor blocker or ARBs are indicated to treat hypertension, congestive heart failure, and diabetic nephropathy. ARB and ACE used during pregnancy reduce fetal kidney perfusion and is associated with renal dysgenesis, fetal oligoric or anuric renal failure, oligodramnus, skeletal or skull deforma, deformities, pulmonary hypoplasia, and fatal death. Next. Effects. Side effects set A. Fainting, dizziness, fatigue, respiratory symptoms, vomiting and diarrhea, back pain, and leg swelling. Adverse effects. ARBs are generally well tolerated and have a low incidence of side effects. The incidence of angioedema and cough with ARBs is less than with ACE because ARBs do not increase bradykinin levels. Next. Nursing implications or responsibilities. These are vital nursing interventions done in patients who are taking herbs, educate patients on importance of healthy lifestyle choices which include regular exercise, weight loss, smoking cessation, and low sodium diet to maximize the effect of antihypertensive therapy. Next. So the last classification of antihypertensive is beta blockers. Drug name, LOL. Generic name, Atenol. Brand name, Tenormin. Route, oral route. Frequency, once a day. Dosage, 25 to 100 mg. Bisoprolol. Brand name, Zebeta. Zebeta. Route, oral route. Frequency, once a day. Dosage, 2.5 to 10 mg. Metoprolol. Brand name, Lopressor. Route, intravenous route. Frequency, twice a day. Dosage, 50 to 100 mg. Generic name, Metoprolol XL. Brand name, Toprolol XL. Route, oral route. Frequency, twice a day. Dosage, 50 to 100 mg. Next. Mechanism of action. Catecholamines or epinephrine, epinephrine and norepinephrine bind to B1 receptors, increasing both cardiac automaticity, automaticity and conduction velocity. B1 receptors also stimulate renin release, which raises blood pressure. Binding to B2 receptors, on the other hand, causes smooth muscle relaxation as well as increased metabolic effects such as glycogenolysis. Beta blockers are drugs that block the B1 and B2 receptors, which have opposite effects on the heart. Negative chronotropic and inotropic effects lead to a decreased oxygen demand. That is how angina improves after beta blocker usage. Next. Indication and contraindications. As a class of drugs, beta blockers are primarily used to treat cardiovascular disease and other conditions. Beta receptors are classified into three types: B1, beta 1 or B1, beta 2 or B2, and beta 3 or B3. Beta 1 receptors, which are mostly found in the heart, regulate cardiac activity. Beta 2 receptors, which are found in a variety of organ systems, regulate various aspects of metabolic activity and induce smooth muscle relaxation. Beta 3 receptors cause fat cell breakdown and are currently less clinically relevant. Beta blocking medication are used to treat a variety of illnesses by blocking these receptors. So specific beta blockers are contraindicated depending on the patient's past medical history. Patients diagnosed with long QT syndrome or who have an Torsades D point test in the past should not use drug sotalol. Next. Effects. Side effects: low heart rate or bradycardia, low blood pressure or hypotension, irregular heart rhythms or arrhythmias, fatigue, dizziness, nausea, insomnia or sleep changes and nightmares, dry mouth or eyes, and rare side effects include sexual and erectile dysfunction. Adverse effect. Beta receptors are found throughout the body and have wide range of physiological effects. Blocking these receptors with a beta blocker medication can have a variety of negative consequences. Some patients report insomnia, sleep changes, and nightmares while using beta blockers. Some patients can experience fatigue or weight gain while on beta blockers. Managing these adverse events involves discontinuing the medication. Next. Nursing implication or responsibility. They reduce the blood pressure by slowing down the heart rate and contract- contractility, contractility as well as by improving blood flow by dilating veins and arteries. Non-selective beta blockers can be used to treat a range of conditions but should not be given to patients with coexisting asthma or chronic obstructive pulmonary disease or COPD. It can also mask symptoms of hypoglycemia in diabetics. So that's all.
Hello, good morning everyone. My name is Hadil Zainal, and today I'm going to tackle the drug study about the diuretics. So what is diuretics? Diuretics, also called water pills, are medication designed to increase the amount of water and salt expelled from the body as urine. There are three types of prescription diuretics. They're often prescribed to help treat high blood pressure, but they are used for other conditions as well. So the most common condition treated with diuretics is high blood pressure. Next, so there are three types of diuretics: the loop diuretics, potassium-sparing diuretics, and thiazide diuretics. So what is loop diuretics? This is a medication used in the management and treatment of fluid overload condition such as heart failure, nephrotic syndrome, or cirrhosis and hypertension. So, potassium sparing. Potassium sparing diuretics refer to drugs that cause diuresis without causing potassium loss in the urine. They are typically used as an adjunct in the management of hypertension, cirrhosis, and congestive heart failure. Next is thiazide diuretics. So what is thiazide diuretics? It is the most commonly prescribed diuretics. They are most often used to treat high blood pressure, and this drug not only decrease fluid, they also cause your blood vessel to relax. Next, the example of diuretics. So in the loop diuretics, example is Bumix. It is reduced extra fluid in the body, edema, caused by conditions such as heart failure, liver disease, and kidney disease. So in potassium sparing, the example is amiloride. It is a type of diuretics water pill that helps prevent your body from losing too much potassium. It also reduces the amount of water in the body by increasing the flow of urine, which helps lower the blood pressure. Next is thiazide diuretics. The example of this is microzide. So a type of diuretic, a drug that increases urine flow. They act directly on the kidneys and promote diuresis, a urine flow, by inhibiting the sodium or chloride. Next, the drug name classification. So brand name under the loop diuretics is Bumix. So the generic name is bumetanide. So the brand name under potassium sparing is amiloride. Generic name is Medamor. The brand name under thiazide diuretics, example is microzide. The generic name is hydrochlorothiazide. Next is the route and the frequency. So in the Biomix, the route is per RM and IV infusion. The frequency, once or twice daily, and in IV, every 2 to 3 hours. And for amiloride, the route is oral route, and the frequency twice a day. And microzide, the route is oral also, and the frequency once daily. Next is the dosage available. In the Biomix, in injectable solution, 0.25 milligram or ml. And for tablet, if the patient have an edema, 0.5 milligram. And for infant or child, 1 milligram. And for patient with hyperthermia is 2 milligram. In amiloride, 5 milligram tablet daily, and macrozide is 12.5 milligram once daily. Next, the mechanism of action. And for Bumix, bumetanide appears to block the active reabsorption of chloride and possibly sodium in ascending loop of phenol, altering electrolyte transfer in proximal tubule. This results in excretion of sodium chloride and water, and hence diuresis. Next is amiloride. It works by inhibiting sodium reabsorption in distal convoluted tubules and collecting ducts in the kidneys by binding to the amiloride-sensitive sodium channels. This also promotes the loss of sodium and water from the body, but without depleting a potassium. Next is microzide. So the mechanism of action of macrozide, it works by blocking salt and fluid reabsorption from the urine in the kidney, causing increased urine output. Next, the indication. So the indication of Unix, it is for treatment for edema associated with congestive heart failure, hepatic and renal disease, including the nephrotic syndrome. And for amiloride, it is a treatment for chronic heart failure or uncomplicated essential hypertension. And for microzide, it may use in those patients in whom the development of hyperkalemia cannot be reached, including patients taking ACE inhibitors. So now let's tackle about the contraindication of this drug. So for Bumix, it contraindicated in the patient with hypersensitivity to drug or components of the formulation. It is also contraindicated in patients with hypersensitivity to loop diuretics. And for amiloride, it is contraindicated to use amiloride in the following condition. So if you have a chronic renal insufficiency, concomitant use of drugs that blunt the renin-angiotensin-aldosterone system. The next is microzide. It is contraindicated in patients with anorexia. Hypersensitivity to this product or other sulfonamide-derived drug is also contraindicated. Next, the side effect of this drug. So for Bumix, muscle cramps, weakness, unusual tiredness, confusion, severe dizziness, fainting, drowsiness, unusual dry of mouth and teeth, nausea, vomiting, fast and irregular heartbeat. And for amiloride, the side effect of this drug is abdominal pain, confusion, difficulty with breathing, irregular heartbeat, nausea or vomiting, nervousness, numbness or tingling in the hand, feet, or lips. And for the microzide, the side effect of this drug is upset to the stomach, dizziness, or headache may occur as your body adjusts to the medication. This medication also may cause dehydration and electrolyte imbalance. Next is the adverse effect of this drug. So for the Bumix, the adverse effect, this medication may cause dehydration and electrolyte imbalance. And for the amiloride, the adverse effect of this drug, amiloride has an FDA box warning for hyperkalemia, either one or even when combined with hydrochlorothiazide. Next is microzide. The adverse effect of this drug is seizure, decreased urine, drowsiness, dry mouth, excessive thirst, increased heart rate or pulse, muscle pains or cramps, nausea or vomiting, or unusual tiredness or weakness. Next, now let's proceed to the nursing assessment. So the implication. So for the Bumix, assess fluid status during therapy. Monitor daily weight, intake and output ratios, amount and location of edema, lung sound, skin turgor, and mucous membranes. Notify also a healthcare professional if freeze, dry mouth, lethargy, weakness, hypotension, or oliguria occurs. Monitor the blood pressure and pulse before and during administration. Monitor also the frequency of prescription refills to determine compliance. Next, for the implication of amiloride, monitor signs of fluid or electrolyte imbalances, hyperkalemia, hyponatremia, including dizziness, drowsiness, headache, blurred vision, confusion, hypotension, or muscle cramps and weaknesses. And weakness. Report excessive or prolonged symptoms to the physician. Assess also the blood pressure periodically and compare to normal values to help document antihypertensive effects. Next, the microzide. Monitor for therapeutic effectiveness. Hypertensive effect may be noted in 3 to 4 days. Maximal effect may be required 3 to 4 weeks. And for lab test, baseline and periodic determination of serum electrolytes, blood counts, blood glucose, uric acid, CO2 are recommended. Check also the BP before initiation of therapy and at regular interval. Monitor closely for hypokalemia. It increases the risk of digoxin toxicity. Next, for the nursing responsibilities to the drug administration. So the nursing responsibilities to administer the drug Bumix. First is caution your patient to change position slowly to minimize orthostatic hypotension. Next is assess the vital sign and review food high in vitamin K. Prepare exact dosage or prescribed drug. Record also the administration of the prescribed drug and also monitor the patient response for desired and possible adverse effects. Next, for nursing responsibilities in administering the drug amiloride, this first to remind the patient to take medication as directed to control hypertension and other cardiac condition even if they are asymptomatic. Next is counsel the patient about additional intervention to help control blood pressure and cardiac dysfunction, including regular exercise, weight loss, sodium restriction, stress reduction, moderation of alcohol consumption, and smoking cessation. Instruct patient or family and caregivers to report troublesome GI problem such as severe or prolonged nausea, vomiting, or constipation. Lastly is the nursing responsibilities in administering the drug microzyme. In administering this drug, first give with food or milk if GI upset occurs. Second is mark the calendars or provide other reminders of drug for alternative day or 3 to 5 days or week therapy. Reduce dosage of other antihypertensives by at least 50% if given with thiazides. Readjust dosages gradually as BP responds. Next is administer early in the day so increased urination will not disturb sleep. And lastly, assess, measure, and record weights to monitor fluid changes. So the quote is, "There's no drug on earth that can make life meaningful." It is from by Sarah Kane. So thank you for listening.
Okay, so hello, good morning. I'm the next reporter. So for my drug study, I have the anti-hyperlipidemic drug. So anti-hyperlipidemic agent promote reduction of lipid levels in the blood. Some anti-hyperlipidemic agent aims to lower the level of low density lipoprotein or the LDL cholesterol. Some reduce triglyceride levels and some help raise the high density lipoprotein or the HDL cholesterol. By reducing the LDL cholesterol, they can prevent both the primary and secondary symptoms of coronary heart disease. So next would be the drug names and the therapeutic name or the drug name that na-assign sa ako is the anti-hyperlipidemic and the brand name is which is the Mevacor. Na-change lang siya, na mali lang gamay. So the brand name is the Mevacor and the generic name is the Lovastatin. So the route is the pre-orim or the oral route. The frequency is in 2 weeks or the duration is 4 to 6 weeks. The dosage available is in initial is 20, 40, or 60 milligram. Maintenance is 20 to 60 milligram and maximum to 60 milligram daily. Next would be the mechanism of action. Interferes with the hepatic enzyme hydromethyl glutaryl coenzyme A reductase. By doing so, lovastatin reduces formation of mevalonic acid, a cholesterol or a cholesterol precursor, thus interrupting the pathway by which cholesterol is synthesized. When cholesterol level declines in hepatic cells, low-density lipoproteins are consumed, which also reduce amount of circulating total cholesterol and serum triglycerides, and the decrease in LDLs may result in decreased level of apolipoprotein B, which is found in each LDL particle. Also in indication and contraindication, first I'm going to read the indication. Indication would be the pravastatin, lovastatin, and simvastatin are indicated for patients with documented CAD to slow progression of the disease. Together with these three agents, atorvastatin is used as prophylaxis for first myocardial infarction attack for patients with multiple risk factor for CAD. For the contraindication, the allergy to HMG-CoA reductase inhibitors prevent severe hypersensitivity reactions. Also in the active liver disease, exacerbated by drugs therapeutic effect and has potential to lead to severe liver failure. Also in pregnancy, lactation, potential for drug adverse effect to fetus or neonate, and impaired endocrine function, problems can arise due to alteration in the formation of steroid hormones. And last is the renal impairment. Caution is given to patient taking other statins and close monitoring in instituted 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 Atorvastatin is not affected by renal disease. Next is for the side effects and the adverse effect. For the side effect would be the heartburn, nausea, vomiting, diarrhea, and stomach upset. And for the adverse effect, the CNS or the central nervous system would be headache, dizziness, insomnia, fatigue, blurred vision, cataract development, and the CV would be the increased risk for cardiovascular effect with simvastatin started at 80 milligram for new patient. And for the GI or the gastrointestinal would be the flatulence, nausea, vomiting, cramps, abdominal pain, and constipation. Next would be the nursing assessment or the implication and responsibility would be to give lovastatin cautiously in patients who have history of liver disease and patients who consume large amount of alcohol. Give drug 1 hour before or 4 hours after bile acid, sequestrant, cholestyramine, or cholestypol. Expect patient to be prescribed a standard low cholesterol diet during therapy. Be aware that during if affects mainly total cholesterol and LDL levels, it has only slight effect on HDL and triglyceride levels. And also for the patient teaching or the responsibility of the nurses, tell the patient who takes drug once daily to do so with the evening meal to enhance absorption. Advise patient to report muscle aches, pains, tenderness, or weakness, being especially watchful of these symptoms when dosage is increased. If present, tell him to stop taking lovastatin immediately and notify prescriber. Instruct patient to report severe GI distress or vision changes, as well as the development of dark urine, fatigue, loss of appetite, right upper abdominal pain, or yellow of skin. Advise patient to avoid performing any hazardous activity such as driving if cognitive impairment develops and to notify prescriber. Tell patient to alert prescriber of any over-the-counter or prescription drugs being taken because serious drug interaction could occur. So that's all for our report. Thank you for listening.